Know Your Numbers, brought to you by Excellus Blue Cross Blue Shield. Let's start by talking about blood pressure. Your heart pumps blood throughout your body in vessels called arteries. As the blood is pumped through the arteries, it creates pressure against their walls. Healthy arteries are made of muscle and an elastic tissue that stretches when the heart pumps blood through them. The more forcefully the blood pumps, the more the arteries stretch to allow blood to easily flow. Blood pressure measures the force pushing outward on your artery walls. Blood pressure is necessary to live, and it's normal for blood pressure to fluctuate throughout the day. However, if your blood pressure remains elevated, the arteries can get stretched beyond its healthy limit, creating complications. Hypertension, or high blood pressure, is known as a silent killer since it has no early significant symptoms and can be deadly. Untreated high blood pressure can damage and scar your arteries. This can force the heart to work harder than normal and put extra strain on your heart and arteries. You may not feel that anything is wrong, but high blood pressure can permanently damage your heart, brain, eyes, and kidneys before you feel anything. High blood pressure can often lead to a heart attack, stroke, kidney failure, or other health consequences. Regular medical checkups that include measuring blood pressure and early diagnosis of unexplained or vague symptoms can save your life. The following chart depicts various blood pressure ranges and their risk categories. Cholesterol is a fat-like substance made in the liver. Some cholesterol is needed for our bodies to function properly, but when too much cholesterol is present, a thick, hard deposit known as plaque may form in the body's arteries and narrow the space for blood to flow to the heart, which can lead to heart disease. There are different types of cholesterol. LDL is the bad cholesterol, the kind that can clog your arteries. HDL is the good cholesterol. HDL helps clear fat from your blood. A high level of HDL and a low level of LDL can help protect you from a heart attack. Triglycerides are another type of fat in your blood. If you have high triglycerides, your chances of having a heart attack are higher. It is best to maintain total cholesterol under 200. The following chart depicts various cholesterol ranges and their corresponding risk categories. So why worry about your cholesterol level? Well, having a high cholesterol level is one of the major controllable risk factors for several types of diseases affecting the cardiovascular system. Cholesterol can build up in the walls of your arteries in the form of plaque. Over time, plaque can cause narrowing and hardening of the arteries, which is called atherosclerosis. Narrowing of your arteries due to plaque can stop or slow down the flow of blood to your heart. When the arteries narrow, the amount of oxygen-rich blood is decreased. This is called coronary heart disease, or CHD. Chest pain or angina happens when the heart does not receive enough oxygen-rich blood. Plaque buildup can burst, releasing cholesterol and fat into the bloodstream. This release of fat and cholesterol can cause your blood to clot, which blocks the flow of blood. This blockage can cause angina or a heart attack. Lowering your cholesterol level decreases your chance for developing these cardiovascular diseases. Diabetes is a disease in which your body either does not produce insulin, does not produce enough insulin, or does not use insulin effectively. Insulin is necessary for the body to be able to use glucose, a basic cell fuel, for energy. The two types of diabetes are type 1 and type 2. In type 1 diabetes, formerly called juvenile onset diabetes, the body no longer produces insulin and therefore requires insulin injections to treat. In type 2, formerly called adult onset diabetes, the body either has an insulin deficiency or doesn't effectively use the insulin being produced. Diabetes often goes undiagnosed because many of its symptoms seem so harmless, or in some cases of type 2 diabetes, there are no symptoms. However, if you're experiencing symptoms such as frequent urination, unusual thirst, cuts that are slow to heal, tingling or numbness in hands or feet, or any other symptoms listed on the slide, you should discuss them with your physician to consider testing for diabetes. A simple blood test called fasting blood sugar, an oral glucose tolerance test, and a complete medical history and physical exam are used to diagnose diabetes. Early detection of diabetes symptoms and treatment can decrease the chance of developing the complications of diabetes. Diabetes is diagnosed with a fasting blood sugar of 126 or higher. Ideal fasting level is less than 100. Diabetes increases your risk for many serious health problems. The good news is that with the correct treatment and recommended lifestyle changes, many people with diabetes are able to prevent or delay the onset of complications affecting the heart, kidneys, eyes, and vascular system. In order to control your likelihood of developing high blood pressure, high cholesterol, and diabetes, you need to know your risks. There are risks you cannot control, such as family history, age, gender, and race, but there are many that you can control. Maintaining a healthy weight, not smoking, managing stress, staying active, eating healthy, and minimizing alcohol intake can all help prevent or manage these conditions. It's always a good idea to talk to your doctor about your risks. Eating can be one of the great pleasures in life. Food has become more and more convenient and people's lives have become busier. This has resulted in more processed foods, which tend to contain more sodium and unhealthy fats than whole foods that have no or minimal processing. An easy way to try to eat healthier is by focusing on consuming more whole foods such as whole grain rice and breads, raw or frozen fruits and vegetables, lean cuts of meat or poultry or fish, and low-fat milk. Also try preparing foods in a low-fat cooking method such as baking and broiling. Try using herbs and spices instead of salt. Following these basic guidelines can help to lower your fat and sodium intake, which can benefit blood pressure, cholesterol, and glucose levels. Staying active can help reduce your risk of high blood pressure, high cholesterol, and diabetes, as well as many other conditions. If you're just beginning to add activity into your day, be sure to check with your doctor. Start slowly, warm up before, and cool down after activity to minimize injury. Choose activities that you enjoy and that fit into your lifestyle. Finding a buddy to join you can help and keep you committed and motivated. Make safety a priority by staying hydrated and wearing appropriate clothing and footwear. Tracking your progress with a pedometer and journal can help you keep motivated. Please visit these helpful resources for more information on healthy living.